Hey guys, this is Dr. Hub. Today we'll look at lithium and its use in the bipolar disorder. So first, the guidelines of the lithium therapy. So where are the indications? So the indication is, it is in terms of mania and in terms of the hypomania, as well as in terms of the bipolar disorder. So what are the blood levels of lithium? So blood levels of lithium, this is for the therapeutic purpose. So in terms of the therapeutic purpose, there is treatment of acute mania. So this includes 0.8 to 1.2 milliequivalents per liter. Then let's look at the prophylaxis. So under prophylaxis, this is to prevent the relapse of bipolar disorder. So we prevent the relapse. And this is of the bipolar disorder. So BP, let's write it as bipolar disorder. And this is going to be 0.5 to 0.8, and this will be the milliequivalents per liter. Next we move on to the toxic levels of lithium. So there is toxic levels, and this is of the lithium, and this is going to be greater than or equal to 1.5 milliequivalents per liter. Now let's look at the contraindications. The contraindications, it includes the CKD, and there is also the heart diseases, as well as the hyponatremia or the diuretic use. Then we move on to the baseline studies. So what do the baseline studies include? The baseline studies, it includes the BUN. So what is BUN? BUN stands for the blood urea nitrogen, and there is also the creatinine. There is creatinine, then there is calcium also, as well as the urine analysis. Then we look at the thyroid function test. Then there is also the ECG. So the ECG is seen in patients with the coronary risk factors. Now let's look at the acute adverse effects. So acute adverse effects, it includes, there is a presence of tremor, there can be ataxia, as well as there can be weakness. Then there is also presence of polyuria, there can be polydipsia, there is vomiting, diarrhea, as well as the cognitive impairment. Now let's look at the chronic adverse effects. The chronic adverse effects, it includes the nephrogenic diabetes insipidus. So the nephrogenic diabetes insipidus. Then comes the thyroid dysfunction, as well as the hyperparathyroidism.